a client with a diagnosis of cancer is receiving morphine sulfate for pain. So we have a medical diagnosis of cancer and the patient is receiving a medication which is morphine. Anytime they tell you a medication on the stem of the question, that is time to red flag. Why are they talking about a medication? Because usually there is a relationship between the answers and the medication, usually. So I'm gonna think, this is probably about pharmacology. So keep reading. It says, when preparing the plan of care of the client, the nurse should include which priority action? What that tells me is that probably some of the answer, if not all of the answer, will be related to the problem, but I need to identify what is the most important action to take. So I have to think about prioritization. And of course, this is the Maslow strategy practice class, so let's practice that strategy. Step number 1 says, identify which answers are physiological and which answers are psychosocial. So stools, urinary output, fluid intake, cough and deep breathe, they all deal with a physiological need. Some students, when they read this question and the answer, they say, well, encourage, professor, can that be seen as teaching or about knowledge? Could that be psychosocial? No, because you're doing something that when the patient completes it, deals with a physiological need. Like if I tell a patient, drink fluid, drink more water. They drink more water, that's physiological. Cough and deep breathe. Follow those instructions. Deep breathe. Well, that's going to help with the breathing, oxygenation. So all of the answers are physiological. So step number 1 is done. Step number 2, I don't have any psychosocial answers, so I can just skip that one. Done. Now, does it make sense? When you look at these answers, does all of them make sense? So I go one by one. Monitor stools. Does that one make sense? Well, of course, yes. Why? Patient receiving morphine, we know that a side effect of administration of morphine is constipation. And if there is constipation, monitoring stools is important. So it makes sense. Monitor urinary output. So when I look at answer number 2, is there a close relationship between morphine and fluid volume deficit, fluid volume loss? No. So in this case, monitoring the urinary output is not as important. So I will eliminate that. Encouraging fluid intake. Does that make sense? Yes. Why? A side effect of morphine is constipation. If I encourage fluid intake, it helps to prevent constipation. Excellent answer. Makes sense. Number 4, cough and deep breathe. Does that make sense? Yes. Why? Because morphine depresses both the cough reflex and the respiratory reflex, or the respiratory center. So answer number 4 makes sense. So step number 3, done. Step number 4 says, apply ABC. Does answer number 1 deal with ABC? No. Eliminate it. Does answer number 3 deals with ABC? Yes. So I have to keep it. Does answer number 4 deal with ABC? Yes. So I have to keep it. Now, which one is airway, which one is breathing, and which one is circulation? Answer number 3 is circulation. Answer number 4 is airway breathing. Maslow's hierarchy of needs says airway breathing has the priority over circulation. Therefore, 3 is eliminated and 4 is the correct answer. Does that make sense? So maybe you didn't follow all these steps. If you only go back to content, most of these questions are designed for you to think of content and you get distracted only with content. But remember, this is not a remember what is good or bad. Here is several of these answers make sense. What is the priority? Is stool circulation? No. No circulation in stool. Where is the circulation in stool? Think about that one. And also, remember the what if syndrome. What is the what if syndrome? When you add more stuff that doesn't exist. Trust me, you can make everything circulation if you want to. If this and this and this and this and this happen, then the heart will be affected and then no blood is pumping out of the heart. Okay, yeah, of course. Yeah, circulation. But remember, you don't have to think that deep. Look at 3, fluid intake. Fluid is circulation. Look at 4, breathing. That is a oxygen need. So keep it simple. Do not overthink these scenarios.